Welcome to the Asking Why podcast. I'm your host, Clint Davis. Glad to be back. We've had a month off. We had some technical difficulties a month ago with a guest, but she's going to come back on next year because we're already at the end of the year. So it's December. Man, I'm excited for Advent. Dr. Malone is back with us. This is your third time, I think, third or fourth time. I can't remember now to look back. But I love every time I get to talk to you, man. We got to talk a bit before and just thankful for your friendship and what you do in your life. And for those who haven't listened to the podcast, maybe you're jumping in on this episode. Dr. Malone is an expert in sexual health and biology and chemistry and things that align with the Christian ethic. And he does a beautiful job of allowing science and technology and all of those things to come together to help men and women in sexual health and in their bodies and in lifestyle changes and choices that can really, give us a really good baseline for how we should be living according to Scripture. And so today he's going to be talking about women's health particularly and some of the things they've been going through. So welcome back, man. Glad to have you.
Thank you, Clint. It's always an honor to be here. And I always enjoy our conversations. Hopefully other people enjoy listening to them as well.
Yeah, they do. I always get tons of good feedback about when we talk about stuff. They're like, we wish that was like 5 hours. I'm like, well, we got 45 minutes. So you don't want to hear us really talk for 5 hours. Well, good, man. Well, catch me up on what's going on and kind of what you want to talk about today and how we can talk about kind of Christian women's wellness issues. I know that hits home for you in this season. So
yeah, this season we've been going through, my wife, Jody, and I, we got hit with the news just about a year ago. It's December 6th of 2024 that she had stage 4 cancer. And she had a hysterectomy, a complete hysterectomy, almost exactly 4 years before that, Christmas time 2020. And she had one endometrial polyp that was cancerous that they'd found. And so they did a complete hysterectomy and told us, there's no chance that it'll ever come back. You got the good kind of cancer if you have to have cancer. And so we just kind of put it aside. And she was being examined every 6 months vaginally for its, recurrence, and nothing there. And then after 2 years, she went to once a year. And again, the doctors explained it to me. They explained this to us later that they checked vaginally like that for this type of cancer because it has less of a chance, less than a 1 in 20 chance of coming back in the first place. So less than 5%. And then also when it does come back, it almost always shows itself by creating a crust inside the woman's vagina that the doctors find on examination, or if they don't find it, it breaks and bleeds. So it gives a warning that things are going on there that shouldn't be going on. But of course, this one didn't. And so it was growing and growing for 4 years. And by the time we figured out what was wrong with her, she was having all kinds of trouble walking around, holding her stomach in because these tumors were pushing out. We had no idea what it was. And she had a bunch of fluid on her abdomen. They took out 7 liters at a time that these cancers were giving off, creating. And so when she got the CT scan, December 6th of 2024, it was just a huge blow, to us. And again, it was from her thighs up to her top of her just below her neck. Yeah. So she was in chemo for 5 months following that. It was a miracle of God, though, Clint and listeners, because I happened to be seeing a doctor that was part of this whole blood doctor, but also oncologist. And they got her in just quickly. So within a month, she was being treated, and she had all these procedures in between that month, all these different things they had to do to find out what kind it was. And she had to have a port put in and for the infusions. So all that said, it was a tough 5 months after that, and there's some more that I could more detail where we thought it was gone, but it wasn't. They told us there was one spot left, like right up here in her chest. Anyway, they went in, on a biopsy and found it wasn't cancerous. The day we got that call that she was free of cancer, which was August 6th of 2025. Notice I know all the dates.
Yeah. That's
because you're living for those kinds of things. They called us and told us that wasn't cancer, and there was no cancer in her whole upper chest. There was no cancer in it at all. We laughed and cried so hard on that phone call. And the nurse who called us, she goes, "I'm so glad I get to tell you this news." So
yeah,
she was in remission from August 6th until about, a week and a half, maybe 2 weeks ago. So we found out that it's trying to come back. So she's in treatment today, her second treatment. So I think the good news is that we're way ahead of where we were. The bad news is it came back at all. So, but it set up things for yours and my conversation today. And it really inspired me and Jody, but me especially, to think in terms of preventing this for other women, because I would not wish this on anybody, what we've been through, the nausea, the constipation, the throwing up, it's just been a terrible experience a lot of the time. Although Jody did better than a lot of other people have, but it's not pleasant for anybody. So I got to thinking about God's, really his bringing me to this place where I'm at, in my professional career, where I ended up working at a university, creating a women's program for college students at a university, literally a class called Women's Personal Conditioning. And then from that class, because I had a lot of sorority presidents and women in the class that asked me to come speak, and work with their sororities to help them be more fit and healthy. And the reason I was doing it overall is because, what the research is showing recently is that young women, girls and young women, as they go into that age where they're going to be, bearing children, a lot of them, they whatever state of health they're in at that time really affects the baby's whole life, because things get constructed in utero correctly or they don't. And literally the baby uses the mother's bones, fat, and muscle to create itself, So what the woman's eating is important kind of indirectly, but it's what they've built up already, what kind of shape they're in already is the major factor in what happens with the babies. So that was the reason I was doing it initially. In getting a PhD around that, I found in my working with him, because I interviewed 32 of them in depth in like an hour and a half. And then I had 10 focus groups of the classes that were all the women's classes. And what kept coming out above nutrition problems, above exercise problems, was this thing they called the hookup culture. And I'd heard of it, but I had no idea, what it was really all about. So from that point forward, I went to my PhD committee and asked them, could I change my focus from overall, especially young adult women's wellness, to young adult women's sexual wellness? And they said, because I shared with them what I discovered. They said, yeah, nobody's, your first one was pretty rare. The overall young women's wellness was pretty rare. And looking at it from the perspective of wanting to have healthier outcomes in future generations by doing it. But they said, this is really, really, unique. So, and nobody's doing it that we know of. So that's what my PhD ended up being in. You can't see it, I don't think, in this picture, but I've got the first book that I wrote in relationship to that was called Battles of the Sexes. The second book that I more recently wrote for Heartbeat International, the pro-life folks, was called Women's Sexual Wellness. So, and again, I've had a ton of time to research, because I got canceled at the university that I was teaching at because I wasn't going along with the program, as far as, the things that were going on in kind of the woke sphere there during that time period. So I ended up with a lot of time to research and started speaking, on these issues and that type of thing. Along the way, the research has shown that a young woman, a girl or young woman's sexual lifestyle leading to their pregnancy time also makes a huge difference on their lifetime health, as well as the baby. So, and what I mean by that is, and this has changed, by the way, in the last several decades to be much worse than it ever was before. We have today, Clint and listeners, have a situation where women under 50, so women under the age of 50, as compared to men under the age of 50, are getting cancer at nearly twice the rate that the men are. A lot of that is reproductive cancer. Being breast became the number one most prevalent cancer type in the world starting in 2020, and it's just continued on since then. And then the other big, very increasing one is, well, my wife has uterine cancer. Endometrial cancer is a type, it's a type of, it's a part of the uterus. Oh, so those two are really increasing quickly. And what it goes back to is, in the last decades, especially since the 1980s forward, we've had women and men, but women especially, getting married later than they ever did before, because historically, United States wise, and going clear back into the colonies, the beginning of the country, the average age of a woman marrying was between 20 and 21. And that matched up real well with kind of the physical situation, which is, again, where I'm coming from, because women's peak fertility is age 19 to 29, and it starts declining rapidly, especially after age 32. So from 32 to 35, they lose about half of their fertility. And then from 35 to 40, they lose the other half. Now, again, there's options to, there's births after age 40 with some women, but it's very,
Right.
very
Those
rare.
are exceptions, not the rule, right?
Exactly. So what it worked out to be is that with this increasing age at marriage, and therefore in most cases increasing age at first childbirth, it's turned out that the women that have their children start having children at an age that's closer to age 20 versus one that's having her first child closer to age 30 or plus, more than age 30, has half the risk of breast cancer than the older woman. The younger one has half the chance of breast cancer as the older one. The other thing that's another factor that's different from the past, because, again, you and many of your listeners will probably know that the average number of births to a woman in the 1800s, 1800 maybe to 1850, was 7. So there's a lot of them didn't make it, through birth, through the birth process. But so they had more pregnancies. How that affected women was that it kept them as a natural way of keeping them from cycling. And so having their menstrual cycle. And so a woman ancestrally only had 160 menstrual cycles over the course of her reproductive life. Guess how many our women are having now? 160 for the ancestors. How many do you think our women are having now?
Over 400 or 500, I'm assuming.
Yes, you're exactly right. 450. 450. Wow. Great estimate.
That's a wild goose guess there.
No, but every time, this is your listeners, and especially young women and people who love them, need to get this news out to them, that every time a woman has a menstrual cycle, the tissue in her breasts and the tissue in her urogenital tract change, and especially like their uterus. That's what it is, is all that tissue coming out, and every month that you don't get pregnant, it keeps doing that. So every time there's that changeover in the cycle, there is a greater chance of cancer, because cancer does really well in situations where cells are dividing and where cells are changing. It doesn't do so well where cells are stable. So again, in a pregnant situation, and then also estrogen itself is a big carcinogenic factor if there's too much of it for too long in a woman's system. And again, when a woman has pregnant and then breastfeeds, both of those things shut her cycle down. So they stop having this change all the time, if that makes sense.
Yeah, it makes sense. So what you're saying, let me summarize real quick where I'm at and for the listener. So what we're talking about is that over time, women have had less children, have been pregnant less. So they've had more periods. I mean, almost 4 times as many periods as the women historically. And the correlation there is that because they're not breastfeeding, they're not reducing the stuff in their bodies that they need to reduce, and they're shedding more than they need to shed. And so therefore the correlation of cancer, especially cervical and breast cancer, is increasing.
Absolutely.
Okay.
That's perfect.
That's crazy. I mean, I know you're going to bring this in, but I'll just go ahead and hit it up. It's like, when God tells us in Genesis to go and procreate and spread, our population, to have many children, to be able to do those kind of things. This individualized culture that we have, where we can't afford to have more kids, or we don't value having more kids, is really costing us, not just relationally and socially, but physically and spiritually, for women who we're talking about now that we care about, with cancer, with physical and emotional and spiritual issues, and us as men, as husbands, as fathers, as brothers, as friends, having to watch women suffer through cancer, cervical and breast, on an alarming rate. My mother-in-law had a double mastectomy. These things are very, very common in our lives. Most people who are listening to this have someone or are someone who has struggled with this or is terrified of this. And so it is interesting to look at how's the culture we have in our disobedience and in our pursuit of technology and advances, and, a society that has a bunch of stuff at the cost of having children. We're paying for that.
Yeah, absolutely correct. And you said you so well. And it's something that's preventable. And that's what I would love to, with this Christian women's wellness, the idea, and I'll get more into the details in a minute, because it's even more fascinating as it goes. It's fascinating, but it's terrible at the same time, because when you live with somebody and you love them with all your heart, like my wife and I, and you see them suffering, and you're really powerless in yourself to do something about it, other than all the things that they're important, the support, the love, the hugs, all of that. But you literally can't, you have to depend on chemotherapy and doctors' expertise, which have been great, by the way. We've been really blessed to be where we're at here, the people that we're working with, and God working through all of it. But it's a terrible position to be in when you don't have to be in it. Now, real quick, and then I'll go back to some of the other things that, if hopefully people are listening to this that either are young girls and young women or know young girls and young women, or that love them, that want to see them not have to go through this. And you're exactly right. Getting this right helps everybody, men, women, everybody, future children. So, I
Yeah,
was
and
in,
if you're a feminist and you're in a culture where you really are progressive and you really go to the extremes of these things, then what a beautiful thing to talk about. Caring for women, taking care of their bodies, making sure that they're not getting cancer and not dying early and not suffering longer than is necessary.
exactly. And, we've come to this realization, I think, with a lot of other things, that you have two choices on things. The natural alternative is going to be better. Again, with the whole, make America healthy again, taking this dyes out of the foods, the whatever, whatever they're working on, getting the glyphosate, I guess it is, out of the spray, they're spraying on the crops, et cetera, et cetera.
Yeah, the
Natural,
water we drink not having 10,000 ounces of chlorine in it, and everything else in
right.
all of our cities. Yeah.
Natural is generally, and that's a bit what I found in my long career now as a wellness professional, is that natural has always turned out to be better. Well, we think that way on food, we think that way on exertion, we think that way on all the obvious things, the sunlight, dark, but we don't think that way on reproduction. And we need to start thinking that way on reproduction, because, that sharp of a change from the 1800s, going from 7 on average children, going down by 1900 to 3.5, and then going down by 2000 to, and now to 1.6, in America, and even less in other parts of the world. That kind of a change on women's, style and their biochemical makeup and their functioning has to have repercussions. And that's what we're seeing here. We're seeing the repercussions of just, okay, we've got the technology, to create a birth control pill, and we can, stop having more births than we want, or we've got the technology for abortions, etc. And condoms, the invention of a condom in 1845 also had a big, the rubberized condom had a big effect as well, as far as dropping those births. But when you just mindlessly do that, you got to wonder, again, especially up against the very first thing God ever said to us was, go forth and multiply. That's the very first thing he said to humans. So when you think of that being job one, and then us just to take it in our hands and do what we've done, you can see why there's problems. So I was sitting in an economics class back in the early 1980s, State University. I'll never forget the professor up there saying, everybody in this room, and there was like 100 of us, in the room, everybody in this room, there's no reason that you shouldn't be rich, wealthy. Number one, he said, with the economy the way it is and where you live and all that, he goes, number one, you need to wear your seatbelt. Number two, you need to not smoke. Number three, you need to limit yourself to 2 kids. Number four, you have several more, but the limit yourself to 2 kids was something that we all just sat there and took in and thought to ourselves, yeah, do we have birth control? There's no reason we shouldn't just take advantage of it and just have 2 kids. My wife, more than likely, Jody, the love of my life, has this cancer now because she didn't do what her mom did. She's very high estrogen too, by the way. She's estrogen dominant. So women like that need to watch out for this, especially if they've got, hourglass figure and all that, that comes naturally, comes easy. That's telling you they're very high estrogen. But her mother, who was much less health conscious and was obese most of her life and was bedridden for a lot of her life, she lived to age 80 without ever having, a sniff of this. But she had 5 kids. Jody is one of 5 siblings in her families. And again, I've come to this realization too late for our situation. We want to have more kids, but again, I think that was in the back of my mind, and everybody wants to be, financially secure, et cetera, et cetera. I wanted to mention that because the propaganda of the modernists in our society, and even postmodernists now, it has a price to pay for a lot of it if you go against what God ordains. So here's some of the rest of the price as far as what can happen.
Let me ask this one question real quick.
Yeah, go
So
ahead.
I can hear the pushback and the thought process on, one of the pros of contraception was infant mortality rate and women mortality rate because of other problems. So how do we work? I mean, I can assume how you're going to work it out, but I want to hear it from you. How do you weave that in to go, okay, but the pro is still having more babies reduces those things. It's kind of like, for me, it's holding two truths at the same time. It's saying, yes, some of these things were helpful, but still at a great cost. And so how do you mix those two together?
Yeah, that's a great question. And here's how I would do it. I want to always try to be absolutely honest when I'm sharing what God has allowed me to learn. And you're right. Up until 1900, 1 in 6 times that women had a baby died in childbirth. So that's very serious. 1 in 6. So it was a dangerous thing. I remember my grandmother saying, "You got to go down." When Jody was first pregnant, she goes, "You got to go down to the door of death in order to bring life into existence."
Yeah.
So that's a serious thing up to the early 1900s. Again, that's one reason that women's life expectancy was about the same as men's, from that time back, because they had that risk, a pretty big risk every time they came up for a birth. But what's happened since then, Clint, and this is kind of holding two thoughts at the same time, like you said, is that we have invented something called the cesarean section. And the amount of women that die in childbirth now is, I don't know, it's infinitesimally low, I'm sure. I don't know the exact figure on that, but it's definitely not 1 in 6.
Mhm.
So we've been able to come up with a way to save mothers and babies where the baby is breech, or it's too big for her to come through the birth canal. So what I would say is that's an invention, not that it needs to be used as much as they're using it, where they're using it just for minor inconveniences, but where it comes down to saving the life of the mother, then I would say, that puts us in a position where almost no woman's going to face that choice of dying or having the baby. So having a larger number of babies and children doesn't hold the same danger that it did before, is what I would say now. And a recognition of that, that's an advancement that has been very, well, life-saving, and also has gotten rid of some of that, what the pushback that you said that would be logically brought against somebody that's like me, that's pointing out the dangers of going away from the natural progression of things, and the natural way things worked out before there was any kind of substantial birth control or cesarean section, or abortions. So that's what I would say to that. But I do acknowledge that that's a real concern, and it was a real concern. Abortion, we can talk more about this in a minute, but it was, when it was not being done, when it's being done illegally, there's maybe a lot more danger in that, but to the mother. But the abortion, looking at abortion as another form of birth control, which is what I think many people do these days, unfortunately, is way out of bounds of where it should be.
Of course, yeah. The statistic, I looked it up real quick, is that in 2023, there were 669 maternal deaths recorded in the U.S., yielding a maternal mortality rate of 18.6 deaths per 100,000 live births. So we've changed from 1 in 6 to 18 out of 100,000. So that's a pretty good increase in the likelihood of mothers dying.
Yeah, and on the other hand, to kind of compare, thank you for looking that up. On the other hand, we've changed from a woman's chance of getting breast cancer in 1973, before Roe versus Wade, it was less than 1 in 1,000, and now it's 1 in 8.
Right. Yep.
Yeah,
We trade one for another. I mean, I think that's a great point to make, and I think we can look at this, like what I was saying, holding two truths at the same time. And this is hard to wrestle with, the pros of medical assistance and the cons, and looking at it over time, what's convenient, what's not, what's the greater good. and cancer is not the greater good. There's so many forms of cancer that we get now that are unnatural ways of dying versus the natural way of dying. And I think it also has to do with our view of death. We live in a world where we let people live longer and hold on to their physical life, keep them a vegetable, keep them in a really terrible state, work harder on their body to keep them alive, where then they have no quality of life afterwards, which I get is a hard decision. And, if I'm in that position, man, I don't want to be. And when my brother-in-law died of brain cancer, we were there for the days that he was dying and, giving him morphine and trying to make him comfortable, to the point where you're like, man, you just got to go because this is so miserable. Could we have done more things to try to keep him alive longer and suffer longer? Absolutely. But we knew he was going to be with Christ. And so there's this mentality of what is our value on this life now, and how do we cling to it in moments? And I think that plays into this in a big way. It plays into our understanding of, that death is a part of life, and that, we want to limit it as much as possible. We don't want to play God. And if we're playing God and creating less children so we can have more convenience and more wealth and more prosperity, I mean, that kind of played into contraception too, because, mothers were able to birth children fewer and farther between. They could give more attention to the children. So on some level, the kids were cared for better. But now we're in 2025 and we're looking at like our society. And my question is, are children healthier than they were? Like, even if there were 7 or 8 of them, in a family, yes, some of them passed away, which is terrible. Yes, some of them, were neglected emotionally. But now we have 2 or 3 kids who, a family with 1.6 kids who they're getting all their mom and dad's attention and all their focus and all their presence and all their gifts and all their grad school and all their money, and they don't seem to be that much happier. They're the most anxious, the most depressed, the most suicidal, the most confused generation of all time. And so it is a question to ask, how do we find a middle ground? And I think that's what you're pointing to in all this.
Yeah, exactly. Mary Eberstadt, you may or may not have heard of her, but she's a very, very wise woman, has pointed out, I'm not sure she written a book on it, but she calls the concept that you're talking about human subtraction, because human subtraction meaning that the natural state of things is to have maybe 5 siblings in a family, maybe. My Jody's, my wife's great grandmother had 16 kids. So it's like they populated a whole area, out west. But yeah, the thing that Mary Eberstadt points out is that the natural way of things was you learned about how girls were if you're a boy from your sisters, because you had 2 or 3 at least sisters, and if you're a girl, you learned the opposite, from your brothers. So now with the 1.6, it's like you don't get any experience until you get up to, out there with the other kids that have no relation to you. So there's a lot of advantages, like you're alluding to having larger numbers of children in a family. So and that's her point too, besides the fact of the demographic, what do they call it? Demographic dearth, and how that's going to affect the future as far as weight, the older people and not enough young. So
I know you're not saying this yet, but I just want to say this for the caveat for the people that I know are sitting there anxious in their seat. I have 2 kids. During 2020, we had multiple miscarriages in the same way, right? That miscarriage number is super high, and I think increasing. I think it's like 1 in 3 now, and not just 1 in 4, and that's gotten more and more and more. And I think that has a lot to do with, the hormones and the chemicals and the things we've been pumping into women, and the things they've taken since they were 15 to not get pregnant, and then all of a sudden they have to change all of those hormones and the way that the uterine wall works and the chemicals in their body and their breast production and all the shutdown of all that. And I think that's what you're pointing to. And then later they're like, okay, well, I just want to have 2 kids, but then having 2 kids is very difficult. And then, so they lose kids, they have miscarriages, that wrecks their body and their hormones for years as they have these other kids. And then that impacts their RNA and the way that kid's predisposed to things. And so it is a great thing to look at, because I mean, you're paying Peter to pay Paul, or however you say it. You're stealing from Peter to pay Paul. Like, we're thinking, oh man, we want to have a better life for these kids, but we're not really looking at the totality of what we're doing, and it's costing us in ways that we all hate. I mean, people hate cancer. They have those shirts that say F cancer, and like there's the walks and rallies, but I think what you're pointing to and what I'm pointing to is like, how do we find in 2025 a middle ground? And for us, because we're already like yours is because of age, ours is because of the medical consequences of trying, we decided like, man, we wanted more kids, but it's not worth the compromising my wife's body. So that's more of like we talk about with parenting, dealing with, hey, we're in recovery. So there's people listening to this who are already older, who already have one or two kids, who've already fallen into this pattern. They're not going to be able to do much about it in their own personal life. But man, what can they do, and what can we do as leaders, as teachers, as mentors, as disciple makers, to teach younger kids and younger ladies and men to value intimacy and connection and sexual health, to value family and connection and community over money and prosperity in the way that the American culture does it, so we can get back to having in a medically amazing society. Now we're at the time where, man, we could have the best of both worlds. We could have more larger families and more children within the scope of a medical care that actually can keep us all healthy.
Yeah, including mom.
Yes,
Yeah,
especially the mom.
Yeah, they've been, as to your point, as my grandma's generation, it was a huge issue, threat of death at giving birth. But like you said, I mean, take advantage of the things that are logical to take advantage of. Discard the ones that we realize we shot ourselves in the foot with, which is what you're talking about. And by the way, we miscarried one baby too. So it was like 3 months in, and that was a terrible thing. So that was convinced us to not have more too. That was another part of it. But yeah, so let me just give you the rest of the picture on
please.
Of how it goes, and then I want to point out, by the way, everybody that's watching, this is a great book, Building Better Bridges. The guy sitting there next to me is the guy that wrote it. I've kicked myself a number of times for not writing a review, and I will do that in the near future. But I've really enjoyed reading it, and I'll get back to it in a minute on page 196 to 198, especially what Clint said. I'll finish off this kind of the consequences of girls and women's sexual lifestyle, and then I'll get back to the point of wanting to make off of his book. Buy this book if you get a chance. It's great. Not only you can see where I've marked my pages. Not only is the part that we're talking about with this, really sexual integrity education for particularly older teenagers, and particularly older female teenagers, but he has a great section in there on screens and dopamine and just all of the things that we don't realize how we're shooting ourselves in the foot with the different things we're doing with screens, the amount of time, and what we're allowing our kids to do with screens. So here's the rest of the story, though, as far as that lifestyle, changing the lifestyle radically the way we have from 2 to 3 generations back. Major risk factors for breast cancer include delayed childbearing and not breastfeeding. And when they say not breastfeeding, they mean ideally breastfeeding for like a year, both of which result from activities early in a woman's reproductive life. This is to delay childbearing beyond 30 years of age is another factor.
You get into Elizabeth then if it's 90.
Yeah, 90, you'd be doing really good. To limit or avoid it altogether, the ones that are having, no kids, not getting married at all, is to abort a pregnancy, and I'll say why that is the case in a minute, rather than to carry it to term with the adoption option. Not to breastfeed. They all put young women at increased risk for breast cancer, and I'll add uterine cancer as well. Abortion, not only obviously bad on the child, but it's really hard on the woman. And again, note that I said that breast cancer incidence has increased from less than 1 in 1,000 in 73 to 1 in 8 now. So over those years, there's been a lot of abortions. And what happens, and Clint, you may know this already. Forgive me if I'm telling you things that you already know, but there's a process in this whole thing. And what I look at as a scientist, and then secondly, my Christian experience, but I'm seeing as a scientist that the Christian experience lays over on top, overlays, I guess is the word I'm looking for, perfectly what we're seeing in the science as the optimal and most healthy lifestyle. Seeing that abortion, for one thing, it interrupts this process that girls and young women, that most of them don't know about, of their breasts maturing, the cells in their breasts maturing, because they're born with what they call type 1 breast cells. And then at puberty, they get type 2 breast cells. Now, neither one of those right at that point are really going to be good at creating milk and that type of thing. So there's a maturation process going on. At pregnancy, those cells change to type 3, and they go into this what they call lobules. Lobules are like the milk producers. And then when the baby is born and they start breastfeeding, hopefully again for a year, I'm going to repeat those kinds of things so that people listening can know the good stuff to do. That breastfeeding for a year creates a type 4 lobule, type 4 breast cell. Now, the great thing is that if you go to a full term, like at least 8 months in a pregnancy, then you get to that stage 3, the type 3 of the breast tissue. But if you don't, if you interrupt the pregnancy with abortion, you mess up that cycle. So they call it breast cell differentiation cycle. And that sharply raises your breast cancer chance as well.
And the same would be with miscarriage as well? Just
No.
either way no?
The natural miscarriage happens from your body, her body, deciding that this isn't a good thing after all, and disposing, in a natural way of what would have been, what is a baby, but what would become an adult. But yeah, there's been research done on that, and when it's a spontaneous on its own type of thing, it doesn't have the damaging effect that coming in artificially and interrupting that pregnancy and interrupting that maturation process is, we don't, how much of the breast cancer burden is from that, but it's got to be a fair amount with 60 whatever million of them having been done, since 1973. And now with the birth control, with the what they call it, the pill, the abortion pill, that's a progesterone blocker, basically. And again, a lot of what causes these breast cancers for these women and uterine cancers is a estrogen dominant situation. So if you're blocking progesterone to make this, to abort this pregnancy, that cannot be good, for the females, for the mother's long-term health, and probably specifically for their breast cancers.
Wow.
Yeah. So that's kind of the picture. And that's why abortion, you hear abortion, again, 2 8 months. And who wants to have a baby aborted after 8 months? But if the process is completed to type 3, if she carries the baby to 8 months. So that would be a cancer, to be honest, that would be a cancer lowering situation, potential cancer lowering situation for her for the future. But again, most pregnancies most abortions are very early normally in the pregnancy. So it's interrupting that, again, breast cell differentiation process. See, to me, I can picture the process that God has created. There's a picture that's forming as far as it isn't by chance that in American history up to the 1980s that the average age of marriage was 20 to 21 for women, because again, the peak fertility ages for women is 19 to 29. So you're going to get that, you're hitting that sweet spot there. But also, again, the fact that if you get that process going, that breast cell differentiation process going early in your 20s, it has, for whatever reason, it has a big deterrence effect on developing cancer for the rest of your lifetime. So if you see what I'm saying.
Yeah.
Yeah. So that's kind of the overall, and again, having babies younger. Well, first of all, let's say it this way: getting married younger. Consider that, because there's a lot of advantages of that people don't realize.
Well, we talked about this on our last couple podcasts. I love that this is kind of flowing off the last few hours of us having this discussion. I was thinking about Paul and his letters, and we at times try to prescribe, right, like we're doing right now, a different treatment, but we're presupposing that all the other things that we've talked about are happening as well. So they all go together. It's not just like, hey, everybody start having more babies right now and just get pregnant. Like, you have to take your context and your body and where you're at right now. But we are trying to have a conversation about, if we keep doing things like we're doing, they're only going to get worse. And so if we can get back to a Christian ethic where we value the right things, and then we create a lifestyle around being able to value those and do those things in a healthy way, then we could change future generations and get back to populating the earth in a healthy way versus the unhealthy way that we've been doing.
Yeah, you summarize things so well, because that's exactly what I would say if I was that eloquent. Getting to your eloquence, again, building better bridges. On page 196 to 198, I love what you said about, educating the older teenagers. And again, for those that may not be familiar with the book, the thesis of it, and tell me if I'm wrong, Clint, but the thesis of it is that we have a society that, as much sex as we have going on, and, people debate on more or less. And, you point out really astutely that porn has had a big impact on how much actual sex between people, is happening. But people, especially parents, they try to get away from that having a talk with their children about it. They avoid the subject. Let's put it that way. And you do a
Mm-hmm.
good job of bringing that out. But in the book, Building Better Bridges, you do a good job of showing why it's so important to have this knowledge be imparted from one generation to the next generation. You have a phrase that I hope becomes widely used: childhood sexual neglect.
Mm-hmm.
And that's basically not being told these things by trusted parents, especially, but other trusted adults, that in order to avoid problems, and you get educated by porn, and you're, as a child, you're being brought up by social media and all the bad influences that we have in our society. So, but you talk about in those pages, then this, you talk about sex education going one of two ways. Just basically, you're going to do it, and so let's try to prevent as many problems as we can along the way. That's one philosophy that parents and authority figures have. The other philosophy is just abstinence. Abstinence, just don't do it, and we're not giving you any logical reasons. What I'm all about is giving the logical reasons, because, and I know you are too, but there's logic to this. There's logic to saving sex for marriage, because saving sex for marriage on a girl or woman's part is gonna change. Is gonna force changes in the man that she's interested in his biochemistry, literally. And I think we talked about this in the earlier
Yeah.
podcast too. The vasopressin, and it not building up if sex is going on, sex to orgasm is going on. But if there's dating and kind of your old school courtship and that type of thing, the vasopressin's being built up in his brain, and eventually it locks. There's enough receptors for it to lock. And then when
And
it
that's the
locks,
bonding mechanism, right?
that's correct. And then it's double. There's a double part to it, because when that happens, when the vasopressin locks, then it lowers his testosterone enough for his oxytocin, which is his secondary, bonding chemical, her primary bonding chemical. And so it's a process that was meant to be, as far as saving sex for marriage, because that sex, the lack of sex, the lack of casual sex in a relationship really encourages a man to be romantic, and really encourages a man to work to be a better man, to be able to win this woman for his wife. And when you throw sex into the mix, like the sexual revolution has, and I call it the sexual devolution because it's degenerative, I believe, from where we were, it makes it where you don't see the necessity, where guys especially don't see the necessity to get married, because they're getting what they want anyway. And it's, I think, been a lot of the involvement in the marriage age going up so much as it has, since the 1980s, up by about 10 years.
Yeah, I to speak to that, I work with a lot of sex addiction, and I think they're getting what they want anyways is a nuance. I know what you mean, but I'm going to clarify it a little bit, and you can push back or validate. But I think men want intimacy, men want connection, men want deep relationships with their wife, but their biology is made to where if they have sex, early without commitment, that they don't bond. And so it doesn't really matter what they want in their heart. It's what their practice, in their body and in their life ends up determining for them. So it's like, you can want all day to like, okay, I want to wait for marriage, and I want connection, and I want intimacy, and I don't want multiple partners. I want to have good sex with this one person. But if you let your feelings and your biology, and I would say your sin, your desire trump your obedience to what God calls you to do, then literally the consequence of sin is death. And so you enact this death on yourself, where now you're like, you've had sex with this person. And so the thing you actually want, which is intimacy and connection, you get the hormones and the dopamine and the orgasm. Well, you can't get, it's very difficult for you to get past that to the commitment and the connection, because it's not as much of a drug. Is that accurate?
Yeah. And they're really two different kinds of drugs, because the one, I think that you're alluding to, it's like a cocaine, the hookup culture would be like a cocaine habit,
Mm-hmm.
In the brain, it's very, very similar to the reward circuits and everything that's activated. And it's a situation where you're always needing to get more, you need a little stronger dose. You need a little bit more profane situation or
Mm-hmm.
whatever. Whereas the vasopressin oxytocin route, which is what I think you and I are both recommending, is a
Yes.
deeper satisfaction, and not as much zing at one point. At one point, like the orgasm in a hookup situation, orgasm to orgasm to orgasm to orgasm with different women. because scientifically different women do raise men's dopamine and testosterone levels given given the situation where they can have, conquest after conquest after conquest, easy sex after easy sex. It's like an addiction. It's like a cocaine addiction. And it's very interesting how it's destructive. It's interesting. It's very similar to a cocaine addiction as far as being destructive. A man who lives that kind of lifestyle has about 10 years less of life expectancy as one who gets married and has what you're talking about, intimacy. She becomes your best friend, et cetera, et cetera, et cetera. Like my wife and I are blessed to be.
Same.
10 years less. If you quit a cocaine addiction, you have gained about 10 years in life expectancy. Same kind of a deal. If you're on cocaine, you can expect to live 10 years less. Okay. So
You mean God wired our bodies to do certain things and value our bodies as a temple, and if we take care of it, we actually live longer?
yeah, that's exactly what I mean. And, going to that other verse that talks about sin, sexual sin being different than any other,
Yeah.
it's a sin against your own body. Well, we're seeing that. The scientific evidence is kind of everywhere you look here. So yeah, it's healthy. Let's put it that way. It's a healthy and flourishing type of a life. And the oxytocin, vasopressin, getting to that stage, and which is, I think, the natural. It's what you said earlier. Men do want this intimacy, but when people get presented with something like a cocaine addiction possibility, they sample hooking up. It's, as you said earlier, it's hard to get them, reel them back in sometimes because they have a drug addiction, or in this case, it's a behavioral addiction, and everything gets messed up because the women that they come in contact with after that, they know they have a history, as a player, and that's hard to trust them. And because they have this history, and you point out in your book really well, they've got all these memories, of being with all these different women, and then you're going to go and get married to somebody, and you think you're going to forget all that stuff and comparisons and all that type of things.
Yeah, I call it the Frankenstein monster of sex, that we don't get married and then think of all the bad features or all the bad things about our exes. We think about it, from a physical standpoint. Or if you're a female, a lot of times you think about it, I think I say, in all the dating ways, this guy was comforting to me. This guy brought me flowers. This guy knew my favorite verse. This guy could sing, and then you go, well, why aren't you all these things? I want all of these things. And on both ends, man, it's just so toxic and so unhealthy. And it's not love, it's not comparing our spouses to our other conquests or our other, toxic situations, and wanting them to live up to all those expectations is just really that. It's a fake Frankenstein monster that we've put together in our brain that's not real, but that is killing us.
Yeah, killing us. That's exactly right. Dominating us,
Like literally. I mean, that's what you're pointing at, Dr. Malone, which I always love as you're bringing in the science of, in this podcast called Asking Why. And the reason that I love these conversations is because it's important to talk about these things, to get to the root of, cancer, to get to the root of addiction, to get to the root of sexual abuse. We want to, as a society, treat these things. People get really passionate and they'll wear a pink, ribbon, they'll wear an X on their arm for trafficking, they'll do these things. But then when we go to talk about like these root things and really the philosophical, theological, foundational reasons why they're happening, everybody gets lots of people get squeamish and go, that's difficult to talk about, or you're saying this, or you're being sex negative, or you're being anti-woman, or you're being anti-man, or you're just not being positive enough. And it's like, no, the science is bearing that, right? It's not our opinion that these things are happening. The secular science is bearing that these things are not good for us. And like you said, that just proves God's general revelation in the way in which he says, hey, if you do these things, it's going to go well for you because I'm a good father who loves you, and I'm not withholding things from you. I'm not restricting you from the joys of life by telling you don't steal, don't have affairs, don't commit adultery, don't commit murder, don't have other idols. The science bears that doing those things is terrible for us as individuals, terrible for our families, and terrible for society as a whole. So it's a pretty amazing thing to look at.
Agreed. Yeah. Science supports scripture, to put it in a nice, concise phrase. Science supports scripture. And that's what I've discovered independently of, again, my Christianity, my Christian beliefs. I went into this. I wrote that first book, Battles of the Sexes, absolute secular research, sexual selection, natural selection.
Such a good book.
Thank you. It just proves itself out, that God, there's an intelligent design here, even though however it was created, whether it be instantaneously, or if it was created over millions and millions and in some case billions of years. So it has a pattern to it. It has a design to it. And again, I would call it an intelligent design. So to add on to what you're saying, and you're exactly right. I think these young people, both male and female, but especially female, I think they should know these kinds of things, the consequences, because they're the one that's going to be in the treatment room, with having the stuff put through them. They're going to be the ones that have the nausea and the throwing up, that can't sleep at night. It's terrible.
The
Terrible.
surgeries, yeah, the misery. I mean, it's so
Radiation,
miserable. Yep.
et cetera, et cetera. But to your point about, God, these are really guardrails, that God has given us. The guardrails keep us from going off the road. There's even further, proof. And what I'd like to just throw out there, because again, this program I'm trying to offer for churches, for women's groups and churches, called Christian Women's Wellness. And again, a lot of it is based off Jody's and my experience with her cancer, is bringing out this picture of how God wants us to live optimally and most healthy. And the picture is not having sex before marriage with anybody, and then saving that for marriage, hopefully therefore getting married sooner than maybe you would have, maybe especially a lot sooner than 30, and starting to have children sooner than that. And then breastfeeding them, because again, that's what's best for them. And it turns out it's best for the mother. The oxytocin on both of them go up, way up, that type of thing. Avoiding, especially promiscuous sex, before marriage, because, avoiding it altogether, just having your sights set on one person, they have their sights set on one person, because this picture, and listeners, goes bigger than what we've even talked about here with the disease promotion. It goes to things like, what the research that they've done on prostitutes, where what they've shown is that a prostitute's body creates anti-sperm antibodies. So it's her immune system attacking these sperm and the semen that's been put into her, especially if it's multiple times from multiple different people. You can imagine what prostitute's life. They're at levels of anti-sperm antibodies of the ones that do use some kind of a contraception are at 43%. The controls that weren't, prostitutes were 5%. They had 5%. And then the ones that use no contraception were at 61%. So a woman's body, when they're having sex with multiple men, puts these defenses up because it knows this isn't natural. This isn't the right thing to be going on. And what they found on these prostitutes is that in 9 years of this kind of lifestyle, they go infertile. They become infertile.
Wow.
So there's these things that are built into our bodies that are telling us which direction to go, and in many cases, we are ignoring it. STIs, however you want to express that, sexually transmitted diseases or infections. There's 1 million new cases a day worldwide, 1 million new cases a day. And I thought about that, Clint and listeners. I tried to find out how many reproductive age, I think, they classify that age 15 to 49, and that's stretching it to 49 probably. How many there are in the world. And the closest I could get, because I couldn't find any hard numbers on it, you might be able to find it, but about 3 billion in that age group. And so at 1 million a day, it's actually 374 million. So it's a little more than 1 million a day where there's new cases of the STDs. It's only going to take like 9 years to cover all of our reproductive age people that are being, that are not being monogamous.
Wow.
We are a species that was not meant to be promiscuous. I mean, that's what I'm saying. And there's many, many other points. Pansies, who ironically share 98.8% of our DNA, but we're a lot different than them.
They don't act like it some days.
Yeah. Sometimes some of us don't act like it, but they've been created to be promiscuous, and so they don't get STD. They don't get bacterial STDs, the major STDs that we get: chlamydia, syphilis, and gonorrhea. They don't get those. So they've weeded out in their population all of the people that were susceptible to it. But we get them big time, as I'm saying, 1 million a day worldwide. That's the pandemic, really, when you look at it, because humans are not designed to be promiscuous. So, and there's other things. I mean, there's proof, and we may have gone through this in the earlier podcast, but
it's okay.
Physically, again, scientifically, as you said so well, and as I'm kind of I'm known as the sexual integrity scientist these days, because that's where God has kind of brought me to. It wasn't
I
my
love it.
intention. Well, thank you.
Well, yeah, I didn't want to be going around the world talking to people about talking to your kids about masturbation and menstruation and consent and penis and vagina either. But we got to do what we got to do. I mean, these things that you're talking about, and that's why I always love talking to you, is because I know there's another male in the world who's far ahead of me in knowledge and experience that, I don't feel so crazy talking about these things on a podcast with. So I just appreciate your work and value what you're doing, man. You've added so much to my knowledge and my practice and what I'm teaching people. So
Feeling is a very mutual and vice versa. So I admire so much of what you're doing, and your book is wonderful. So one other quick thing on the United States situation in particular, for those
yeah,
that are
please.
listening. HPV is, so the cancer situation on a woman's internal organs are, when we're looking at the uterus, the endometrial fiber, the ovaries, the type of thing, fallopian tubes, and breasts, is basically, affected greatly by having the age that you get married and start having children, how many children you have. I don't know if I mentioned, but 5 or more children they have 100% less chance they have half the chance of developing the cancers, breast or uterine cancers. So all of those things, as far as like the larger family, the things from the past that can happen naturally, affect more the inner organs, the inner female sexual organs. The promiscuity affects the more outward ones, the cervix and the vagina and vulva. So the promiscuity factor is in those arenas mostly, because in the United States, at least, because HPV is the dominant precursor to United States STDs. Yeah. So promiscuity, having multiple sexual partners, which probably connotes not being married, again, is especially a young woman's, she needs to be aware of that.
Yeah. Yeah, absolutely.
It's almost like informed consent. You can do with it what you want going forward. But I think your point, your whole career and your book thesis is that we need to inform them. We need to inform them of the science to this. And then the young people, the kids, you start with kids and you work your way up, which is the way to do it, and age appropriate. So congratulations on all of that. But we need to inform them by the time they're 18 of all these different things, and then they can make their own, choices. Right now, they're going blind. They're going out there blind into all this stuff. So,
yeah, I read did you see the article that came out this week about 800,000 children from 3 to 5-year-olds who are on social media, and many who are dealing with pornography addiction from the ages of 3 to 7 is insane, because of people allowing their child to have an iPad or a phone and have social media, and just how much those things are now, 3 to 7-year-olds. Now, they're not biologically wired to seek those things out, but those things are being sent to them, and they're seeing it and being excited by it and stimulated by it with body parts that don't even work yet, that aren't even ready for those things. And it's just insane, man. And so the prevention that we can do as a society in both of these areas, I mean, it starts at home. It starts with parents and grandparents discipling their children, teaching them, right, to walk in their ways of the Lord and to honor God with their bodies and with their life, and that these things are good for them, they're great for them, and they have amazing long-term outcomes. It's like, I want my children to have great sex. Like, I want them to have intimacy and connection with their wives, and I want them to have easy births and easy pregnancy, and then later in life, I want them to have clean bills of health. And so the science is out, like you're saying. There's one way to get that, and then there's a really, really risky way to do it.
And with the HPV, there's people that I can hear pushback as well. I can imagine it, saying on HPV, if HPV, Dr. Malone, is the major threat as far as STDs related to promiscuity to girls and young women in the United States, and just get the HPV vaccination. Well, it only covers 9 of the 13 cancer-causing HPV strains. So if you're willing to take an over 31% basically risk that you're gonna, not get the bad kind, the cancer-causing type, then go ahead. But I look back to COVID and the amount of public panic over what was it, is less than 1%, less than 2% chance that you were gonna have a problem with COVID. You know what I'm saying? There was a huge reaction to a tiny. Especially if you're young, if you're like less than 50, younger than 50, I'll be conservative, less than 40, let's say. And getting people that were in college, vaccinated, all that type of thing. It's like, look at the risks, look at the risk benefit ratio. Now, I got to say, to be fair, because I want to try to be honest, over 65, I think it made sense, as far as trying to vaccinate.
But definitely. And certain demographics too. I mean, certain ethnicities, were more susceptible and were having, worse problems.
Right. So scientifically, if you have the scientific reason to do it, then I don't have a problem with it. But what I'm saying is that the comparison of the risk versus, getting cervical cancer, getting vulvar cancer, getting vagina cancer is very rare, but those things, to have be sexually active and have taken a vaccination, HPV vaccination, to try to prevent it, it just makes more sense to do it God's way and just save sex for marriage, and make sure you're both, checked before you get married, and you don't have to worry about anything. You don't have to worry about any of these issues that we're talking about. So, but anyway, I've probably taken enough of your time, sir.
No, this is great, man. I could talk about it all day. I think about, going back to root causes, and I just want to wrap up with this. We have to ask ourselves, why do so many teenagers have sex outside of marriage, right? Why aren't they following a healthy sexual lifestyle? And the answer is that their parents don't talk to them about it, because their parents don't talk to them about it. So 98% of adults in 2025 did not have a conversation about masturbation, menstruation, sex in a healthy way. That is a insane statistic, right?
It is.
87% of parents today don't have any rules for devices. No rules, no accountability, no protections for children from all manner of sexuality on a screen. Those two things are the reasons, okay? Underneath that, from a theological perspective, we're all sinners. We all are going to choose the thing that's right in front of us, the thing that feels the best. And you know this, but for the listeners, the scientific answer is dopamine versus serotonin. The instant gratification thing feels really good in the moment, but you always regret it, and it has long-term consequences, where the deferring our reward and dying to ourselves and dying to our fleshly desires and our impulses ends up releasing serotonin when we finally get it, and doing a whole host of beautiful, amazing things to our bodies and a bunch of other chemicals. And so mine and your conversation right now with people listening is, if you're a parent or a grandparent or an individual or a young person, the Word of God, the things that God calls us to, the things that Jesus are pointing us to, they're not moral laws to follow so you're a good person. That is part of it. But the deeper root is, the alternative is death. The alternative is a hell of a life with all of the things that we're all hating and battling and paying millions of dollars to fight against. But that's all superficial preventative or recovery work. That's all feeding and treating symptoms. What we're talking about is getting back to the root and going, okay, no matter who you are listening to this, you can go back to the foundation and teach young children the ways of God, the ways that their bodies are good. God designed their bodies for a certain reason. I mean, you go back to Genesis, Adam and Eve are naked and unafraid. Their bodies are not bad. Sexuality is not bad. Intimacy is not bad. It was a beautiful, amazing thing, and done properly and for the right reasons produces amazing things for humanity. But man, we're in Christmas. It's like sin has entered into the world. Our bodies are broken. They're not perfect. And even if we try to do it all right, man, there's going to be consequences. But the good news is that Christ has come to give us hope for the future, but also hope for today, that we can still make better choices and be educated around the things of our bodies and sexuality. And man, we need a resurgence of going back to, right? There are a lot of toxic things in history, but there are a lot of things that were amazing that we were doing well. And now we live in a time where, like you said, let's do the logical things. Let's use the logical things to benefit us. And let's discard the ways of the world that are not working, that we look around us and go, man, this is all not going good. And, the way we do that is by meeting with our pastors, meeting with our counselors, having good education with our families, shepherding our children well, having these type of conversations that you and I are having, and then practicing something differently with our kids. And what we know through science is that our kids want to obey us. They want to follow us. They will lean towards us if we help them feel safe and if we help them feel like they have an identity that's founded in love.
Right. Exactly. And your dopamine, serotonin example, folks listening, it's in the book. So just make sure you get the book and you'll understand this a lot better. But I'll add on to that a similar analogy, and instead of dopamine and serotonin, and again, kind of the marshmallow experiment, for those who might be listening, they're familiar with it. It's delayed gratification of being the way to go, the way to success in life. I'll add on to that a similar biochemical kind of choice, and that is testosterone and oxytocin, because testosterone is the immediate gratification. Testosterone is the chemical of hookups and porn and et cetera, et cetera. Oxytocin is the chemical of long-term relationships, marriage, family, having children, the things that I think Clint and I would say are the most rewarding things in this life.
Amen.
And to get to that, you have to reject what the society has been saying since the sexual revolution, that the testosterone pathway, and that's for both sexes. If you have people that are polyamorous, both sexes, both male and female, they have unusually high testosterone levels because they're having, all this promiscuous sex. But in marriages, what becomes dominant over time is that whole vasopressin and oxytocin, especially the oxytocin pathway, and it's so healthy. I can't even, I've got a list of them here that I'm not going to take time to share, but all these different things, like your immune system is benefited by oxytocin, by higher levels of oxytocin, your stress levels, your cortisol levels, they call it nature's medicine, and I can see how God, just from what you're saying and taking all the steps you just mentioned to get there, I can see how God put that as the optimal lifestyle and made that the goal for us, because it also matches up with his relationship, the Holy Spirit, Jesus, Holy Spirit, and God. They all are in communal
Reciprocal.
relationship, reciprocal and communal relationship with each other, which is what a great marriage is supposed to be. Is they're your best friend. And if you're listening to me and you're listening to us and you're young, just take it from us that the pathway, the oxytocin pathway versus the testosterone pathway, gets you a spouse, like in my case, Jody, and Clint's case, Sonny, that you would do anything for, and they would do anything for you. And so when you come to these tough times in your life where one of your life is threatened, you've got somebody that's got your back no matter what. I don't know how people go through this. I don't know how they, and you and I were talking before we came on the air. How do you go through something like this cancer thing without, yeah. And without God, without God, first of all, but then also without your life partner, your soulmate, really, and the love of your life, the one that you love with all of your heart. So as much as it's painful to watch someone like that's that important to you, go through this, you couldn't change it. I would not change a thing on it, because if I was going through it, I want her there that same way. And she's going through it, I'm there for her. I love her more than I ever have. And I can't imagine my life without her. I'm not me without her. So, but I say all that to say, young people that are listening to this, or people that know young people, that is the most valuable human thing in this life, is to have that kind of relationship, and then have that kind of relationship with the children that come from it. So
Absolutely.
don't let your life, young people, go the other direction, because you're going to find yourself alone and unhappy. And I can predict that with very high degree of accuracy.
Yeah,
and
man.
I don't want that to happen to you. I want you to have really the good life. And that's what, the research up and down, and most recently at Harvard, that what they've come to is that our relationships are the most important things that determine our happiness in our lifetimes.
It's good stuff. I will give one shout out. You said Sunny, which is my assistant. So as much as I love her, my wife is JC, and so just laughingly, yeah, and that's okay. I know you mixed them up. You get all the emails from Sunny, so I know that was on your mind. So shout out to Sunny. I love you, but JC is my ride or die.
Well, I apologize for that. I just
It's all good.
Emails.
That's right.
But anyway, what matters is that you have somebody. You have JC in this case, and you know exactly what I'm talking about.
Well, and you said this. I mean, you said pushing back against the culture, and I think what I would challenge people is we're pushing back against ourselves. I mean, our own desire to get everything that we can get all the pleasure out of everything. You have this one life now, and so do you. And I think in the culture of church and Gnosticism, and the idea that our bodies are bad and we're only spirits, and that getting mixed up with the flesh and Paul and the flesh and the spirit, and we just have this really negative view of sexuality in our bodies that is not biblical. And so we need to teach young people that sex is amazing and it is awesome and their bodies are good and there's nothing wrong with those things in the right context. And in the right context can be a spiritually, emotionally, physical, amazing experience with one person that you're committed to. And like you've told me before countless times in the science shows, like that commitment and sex together become amazing. But yet you have this culture that says, don't you want to drive a car before you buy it? And it's like, man, what a shallow way of looking at a woman. What a shallow way of looking at a sexual relationship. I had a friend who recently just got married, before they had not had sex. And so I just told him, like, man, just to let you know, before y'all have sex, she's going to probably be in some pain and, it's going to be uncomfortable and it might feel great for you, but it's going to be painful for her. And you need to be gentle and kind. And that's, it's going to take 6 months for you to get in the rhythm and for it to feel comfortable. And he's like, oh man, nobody's ever told me that. And so I just literally talked to him on the way over here and he was like, thank God you told me that. Like, it's been amazing because we knew what to expect and we didn't get all in our head about these things. But, when we put sex as an idol and the end all and we watch Disney movies and Netflix movies and we think, oh man, that pleasure is going to be the ultimate goal. And then we either compromise it by doing it or we wait. And in a church culture, we're told, don't do it. Don't think about it. Don't like it. It's all gross and bad. And then when you get married, it's going to be amazing. It's like, no, it is all those things. But like the context is so important to teach kids, like, why it's good and why it's bad. But what the reality is it's not this miracle that just happens without effort and without compromise and without that sacrifice and without that commitment. But because of all those things, like you talked about, in a sexual relationship with a wife and a husband where you're committed and you're growing and you're having sex for the first time with one another and you're learning with each other and you're laying your life down for one another and you're asking good questions of one another and you're not just looking to consume and to get something out of it and have the best pleasure of all time for yourself, man, your body responds to that in a healthy way and in a connected way. And the long-term outcome is success and a long marriage and a lack of divorce and a lack of adultery and a lack of pornography and a lack of, cancer. I mean, all of these things come from doing it in the way that God designed it. And I hope the secular world can adapt this, for God's sake. But I hope even more so that the church can get back to teaching about these things and about these ethics because God wants us to, and stop avoiding it or speaking about it in such a derogatory way that the only alternative for people is then to, look for the pleasure and the secular modality. And so I think together, in these conversations, I hope that is whoever's listening to this, that you bring people in like myself and Dr. Malone. Pastors bring in people to teach and equip. You teach your people about these things young, often, and over time. And we will see, in my opinion, a revival in these areas, hopefully, that are foundational to marriage, to couples, to parents, and to our society.
Absolutely, completely agree. And that's exactly what I was hoping. I'm hoping will happen with the Christian Women's Wellness is addressing these women's groups in churches and, the Titus 2 admonition of older women, counseling the younger women. That's the idea. Because I understand that I'm wrong on some. I've already been told I'm wrong on some groups, but for the most part, I've been told that these women's groups in churches are typically older. They're typically probably menopausal, most of them, but they all have loved ones that are younger. They all have daughters and granddaughters and nieces and such. Yeah, I absolutely strongly second what you're saying, Clint. We got to get this knowledge out there because the knowledge is on our side. It's on the church's side. So why wouldn't they? Why wouldn't they want to have the science backing them up? It can't hurt, can it?
That's right, man.
So yeah, and your book again is the whole premise of your book is what you're talking about there. And I absolutely agree, and it should be. I guess the goal, if people can look at it this way, is not so much sex education, but sexual integrity education, because that's what
right.
we want. We want them to realize the value of sexual integrity, and not only is it important as far as biblically and morally and that type of thing, but it's also scientifically important, like you said. It truly is a sin against our own body when we take part in these things that aren't what we're designed for.
Mm-hmm.
The intelligent design that we were created with. So we have these huge brains that we have to be so immature when we're born because we wouldn't be able to make it through our mother's birth canal otherwise. And so we need two parents that are loving on us and, all the natural instincts, the oxytocin, vasopressin instincts that a good outcome for a relationship has that you're describing. And then we need to take care of these kids, and we love them, they love us, and it's just kind of, it's an always ongoing cycle. It's a virtuous cycle that's prosperous at the same time. The other one is a downward spiral that is, it's destructive, as you said. It's death bringing is what it is. So
that's right, and we got the proof in the pudding, unfortunately. Well, man, I'm so thankful for you again, and we'll keep in connection and we'll keep going. But thank you for your work, thank you for your research. I definitely want to look more into the Christian women's wellness stuff with you, and anything I can always add, and we can email back and forth, or call back and forth. God, thanks you for coming on, and thank y'all for listening. We hope this is very helpful. Please shoot us an email, message us if you have further questions, if you have things to validate this, if you want us to come in and speak at your church or your organization, your sorority, whatever it is that we can do to help. Dr. Malone and I would love to piggyback off each other in these conversations. So thank you so much, and we'll see you next week.